Good afternoon, everyone, and welcome. We're so pleased to have you all joining us today for this session, and we're particularly pleased to have Rachel Harris joining us from the United States to share her learnings and with us today. And so, before I introduce Rachel for her session, I'm just going to, as many of you will know, going to run through some slides to introduce MMA, My Medicine Australia, for anybody who's new, just to give you a little bit of an introduction to our work. And then I'll introduce Rachel, who will present, and then we'll have 10 minutes or so of Q&A at the end. And so just to get into it, before we start, I'd just like to make a short disclaimer, which is to say that My Medicine Australia's focus is on the development and use of evidence-based psychedelic-assisted therapies within regulated healthcare systems. We do not encourage the use of psychedelic medicines outside of this context, and we do not support the use of these substances in any way that is unlawful. MMA's presentations are intended for educational purposes only. They do not constitute medical advice, and individuals should discuss their individual needs with their healthcare provider. And just as one last comment on this one for today, as anyone who's, as you've registered, may have seen, Rachel's area of specialty is looking at use of psychedelics that is in different contexts to these. And so just to contextualize this a little bit, we do feel that while this is our area of focus of it, using it within regulated systems, we also feel that it is important to learn from use in other settings, whether that's ceremonial and even use that has been in underground settings, because as we transition to these being used in these regulated environments, it's important for us to learn from what has been done before, so that we can deliver these therapies in a way that is safe and responsible as we go forward. So, to begin, looking at the mental health epidemic in Australia, 1 in 5 Australian adults had a chronic mental illness, and that's pre-COVID-19 and expected to be larger. 1 in 7 Australians on antidepressants, which is increased. That includes children and substantial numbers in older people. This leads to massive costs, most importantly to human life and potential, but it does also lead to significant financial costs to society. And then finally, when looking at this, these challenges, we've seen that government and peak bodies have been slow to look at change, often holding the status quo more so than looking to be progressive in looking at looking at changing more quickly. And so, despite the best efforts of clinicians, we're not seeing positive change to it. And the elephant in the room, as we say, is a lack of treatment effectiveness and innovation in the sector. We've seen very little innovation in treatment in the last 50 years. And what we see are remission rates that are quite low, looking at whether we're looking at depression or PTSD, very high relapse rates with addiction, and when looking at eating disorders, extremely large challenges. And so, as mentioned before, despite a lot of amazing clinicians, a lot of them don't have the tools to receive outcomes with some of their patients. So we have some patients that are able to have great outcomes, but large numbers that simply aren't. And so a more of the same approach doesn't appear to be solving the problem. And so this is where we introduce My Medicine Australia. We are a charity focused on alleviating suffering through new treatment options and treatment innovation, looking at the whole system. Our primary focus is on bringing psychedelic-assisted therapies, currently at this stage with a key focus on psilocybin and MDMA, and then also looking at ketamine when used with psychotherapy as well, into the health system in a controlled way. And our indications of success are that these therapies become an integral part of our mental health system, achieving high remission rates, leading to a substantial improvement of our mental health statistics, and that they are importantly accessible and affordable to all Australians in need for whom they're appropriate. So how are we going about this? We look at it, we have 4 key strategic areas that we work within to try to develop the ecosystem within Australia. The first of these is awareness and knowledge building. In the early days of MMA, it was really focused on this because awareness was so low. We do this to all relevant stakeholder groups. We focus on trial results and speaking about the science behind what's happening here. And we do this through many forms. So webinars such as this. We also ran Australia's first summit that was focused on psychedelic-assisted therapies, other presentations. Moving on, we started a professional development program in 2021. Our certificate in psychedelic-assisted therapies is the first course of its kind in Australia, and this is a 4-month course which includes online and in-person learning, which allows healthcare practitioners to upskill, developing the skill sets they need to look to begin to transition into working in this field. It has a world-leading faculty, of which Rachel is a part of. And we have a professional mentoring program, which was started earlier this year, which gives opportunities for CPAC graduates and others who have a foundational training in psychedelic-assisted therapies to continue developing by working closely in small groups with some leading figures in the field. And we're looking at building out other training opportunities for healthcare practitioners going into 2024. Looking at research, we obtained a $15 million grant from the Morrison government, actually, which was, I think, quite surprising to a lot of people to see a Liberal government supporting research into this, especially a couple of years ago, which at the time was the largest government grant into psychedelic-assisted therapies in the world. We have also then promoted the establishment of the Neuromedicines Discovery Center at Monash University, and recently have helped support ANU to establish a registry, which is designed to allow clinicians, as psychedelic-assisted therapies begin to become available in Australia, to have a central place where outcome data can be collected, so we can really learn for how it's going, and to see how to then use that information for further development of the space. And then finally, we are focused on patient access. And so with this work, what we're looking at is regulatory change, as well as what we can do for cost effectiveness. So that includes medicine availability, but then also finding ways to support funding, whether that's through private funding to support patient access in the early stage, or working with funding sources to try to support ways that people can receive funding support. And so to just move on for a last couple of slides related to this, importantly, an important achievement was made earlier this year when Australia became the first country in the world to reschedule psilocybin and MDMA. This was announced in February and came into effect on the 1st of July. And while this is very exciting, we do also have a heavy obligation on Australia to get this right. So for anyone who hasn't been kept up to date, just to let you know about what does this mean. It means that psychiatrists who've trained in psychedelic-assisted therapy can go through an application process to become what's called an authorized prescriber of MDMA for PTSD and psilocybin for treatment-resistant depression. To apply, psychiatrists must first submit details of evidence-based treatment protocols and their clinical justification and training to a research ethics committee. Once an ethics committee has approved that, they can then apply to the TGA for an authorized prescriber permit. And then as an authorized prescriber, they will then be able to prescribe MDMA and psilocybin-assisted therapies for patients who've failed with currently available treatments. So it is a limited access scheme in this early stage as we continue to do more research and to learn more about how these therapies can be appropriately integrated into the healthcare system. And then importantly, treatment protocols within this scheme, they involve 1 to 3 dosing sessions, as this is what's been explored in the research to this point. And these protocols involve preparatory psychotherapy before any dosing session, as well as integration after each one to help foster integration and learning so that the people going through this therapy are able to make meaningful change in their lives. And so just for a couple of updates around this, just briefly, the authorized prescriber scheme, as I mentioned, it began on July 1st. This application process is quite a substantial one, as the ethics committees and TGA are reviewing first applications. And obviously, as it's new, they'll be looking very closely to decide exactly how they would like to proceed and what they're comfortable with. So at this stage, there are still no psychiatrists who've received approval and begun delivering treatment. But we do hope to see some over the next couple of months, and certainly before the end of the year, being able to start delivering services, which will be the beginning of this scheme, which we then will see start very slowly and then speed up with time as things progress. And so just as a couple of final points from us before I pass over to Rachel, for anyone who is interested in learning further, we have more upcoming events. We have some more webinars over the next few months, including Wade Davis in November, Bessel van der Kolk and Gita Vade. And then in December, we have Gabor Mate, so please do register for those. And in November, Dr. Ben Sessa, as well as Dr. Lauren McDonald from Imperial College London, are coming to Australia to run the residential component of our CPAT training this year. And Ben is doing some lectures as well as some introductory workshops for clinicians. So they'll be an amazing opportunity for anyone interested in learning more in person. So please do keep an eye out for those. We'll have registration and tickets available for those very shortly. And then finally, for any clinicians on the call who are interested in exploring, learning more, and possibly looking to start to work in this field, our certificate in psychedelic assisted therapies, it is a really fabulous course with an incredible faculty. Our 2023 version of the course is halfway through at the moment, and for next year, we are accepting applications. So anybody interested, please do go through to our website and you can learn more and register and apply there. And just finally, for anyone else, please keep learning. If you're in any way able to help support us with donations or fundraising, we really do appreciate it. And just continuing to help build awareness of these therapies and of potential for change in our mental health care system. Anything you can do is greatly appreciated. And you can also go on our website for opportunities for volunteering and through our chapters and network and community. And so with that, I'll say a big thank you for listening to this section for me. Sorry, I'm just going to stop my screen share there. And I'll introduce Rachel Harris. And so by a couple of just brief words of introduction, Rachel is a psychologist, registered psychologist from the United States. She's joining us today from Maine. She's also done extensive research throughout her career. And as she'll tell you about, she's written a couple of wonderful books looking at the use of psychedelic medicines. And so, Rachel, thank you so much for joining us today. I know that you've stayed up late to be here with us, and we really do appreciate it. So thank you, and I'll pass it over to you.
Thank you, Scott. Thank you so much. I really appreciate your mission. I mean, we have an epidemic of mental health issues, and I'm as hopeful as you are about the psychedelic medicines. So the talk I'll be giving, you could start the slideshow. Yes, is based on interviews that I did with women elders in the psychedelic community in the United States. And these, my research criteria for interviewing them was that they had been in practice underground, yes, an illegal practice, for at least 20 years. And in fact, many of them had been practicing for 30, 40 years. And so this is a report on lessons from the underground. And these are the people in Western culture who are the most experienced with using entheogens. So I'm excluding the indigenous shaman because certainly they've been using them for eons. I mean, in generations and families. But the Western women have the most experience, and this is the first time they've talked publicly through me about their own calling, how they trained, and their experience and intentions in working with these medicines. So go ahead to the next slide. So the book is based on these interviews, and it flows from different themes that are relevant for training to work with psychedelics. And I want to say outright that these women are not therapists. So they are really outside the psychotherapy world, and of course outside the medical world as well. And they're not shaman either. I mean, one of them did train with a Shipipo shaman, but they're sort of like priestesses. I call them spiritual warriors or high priestesses. So it's kind of a new category for Western culture. And it opens up the question of how do we in this modern culture hold these medicines? What context and frame do we have for them? So right now, we clearly have a medical frame. And of course, that's what Mind Medicine Australia is pursuing. It's within a medical context, which is totally legitimate. There's also a tiny little bit, at least in the United States, of a church container, because the Santo Daime Church and the UDV have been legally approved. These are very small little congregations. So the question remains, how do we as a culture hold and carry and sustain and honor these medicines? So the next couple of slides, go to the next one, and you'll get a sense of in history The Eleusinian priestesses, it was a secret container. This was a mystery school, I think on pain of death if you talked about it. And it was, of course, literally underground. And it was a preparation for dying, which is still what the medicines are about, even though that's not often talked about, except with the studies with terminal cancer patients. That's clearly what they're about. The next slide is another example of how the medicines are held in different cultures. And this is Maria Sabina from the Mexican culture. And she's a Mexican curandera. And it's the title of the book comes from her. She sang in ceremonies. She sang, "I am a woman who swims in the sacred." So the South American cultures, different tribes, had sacred ways of holding these medicines for healing and for spiritual development. The next slide is a different kind of context, not so much for the medicines, but a way of holding these expanded states of consciousness through Jung's experience of diving deep into his unconscious. And so this presented an approach to psychotherapy that's not part of the academic world. I mean, there was, in my years of study, I never had a course on Jungian psychotherapy. It's not included in the traditional psychological approach, but it's clearly an approach to psychotherapy, and it moves through these expanded states of consciousness through dreams and through the experience of the numinous, the sacred. So this is another way our culture holds these altered states of consciousness, but in very small numbers. There aren't that many Jungian analysts. The next slide is the medical way that we're holding them. And then the next slide is an example of the underground approach. And you can see that the protocol with the eye shades and the music is the same. And I talk in my book how that came from Al Hubbard in the 1950s, when he realized that these medicines were healing because they were an experience of the numinous, which is what Carl Jung said was the real process that healed people in psychotherapy. And Al Hubbard is not at all related to Scientology. He's a totally different character. And he understood, because of the sacred nature of these medicines, because of his own childhood spiritual experiences. So I asked the women about their childhood spiritual experiences. And, I've listened 40 years, I was in private practice for 35, 40 years. So I've heard a lot of childhood experiences. And people don't usually talk about their spiritual experiences in Western culture. They've learned to be quiet about them. And I think that's generally a good idea, but often people, after working with me for a while, felt safe enough in my office to begin to talk to me. And so I asked these women who've been working underground, the theoretical question is, did you come to these medicines because you already had spiritual experiences, or did you begin to have spiritual experiences because you were working with entheogens? And what I'm pretty convinced of is many of them reported childhood spiritual experiences, full out initiations, spontaneous, mystical experiences that they really, not only do they not talk about their underground work, but they don't talk about their childhood spiritual experiences. And one of the women said, no, she really hadn't. And then she went on to describe the loveliest childhood I'd ever heard. Obviously a therapist doesn't always hear lovely childhood stories, but she didn't have a specific spiritual experience as a child, but she described an idyllic experience where she felt loved by a whole neighborhood, by a whole community, by extended family. She had a godmother and aunts and uncles, and it was just a description of childhood surrounded by love and a feeling of safety. You know, this is probably an audience of psychotherapists. You can probably count on one hand the number of clients who come into your office and describe this kind of unusual, such a healthy, beloved childhood. But the others had unusual experiences in dreams, and sometimes talking to trees, not in dreams, in childhood play. I mean, there was quite a variety. And I think this is important because when, as adults, they encountered the entheogenic medicines, they recognized immediately, I've been here before, this is a spiritual experience. And so they held the medicines from the very beginning in a sacred container from their own personal lives. And the next slide. And I can say, another thing is that the eldest of the elders, who's now 90, these women were mostly in their 70s, but the eldest is in her 90s, and she came through the lineage of Leo Zeff. She was actually trained by Leo Zeff, who began working in the late 50s, early 60s. And that's the book I recommend. You can get it free on the MAPS website. It's The Secret Chief Revised, or revealed, I think. And it's Myron Stolaroff's interview with Leo Zeff. And so the eldest of the elders described her work with him and how she was trained. And she said, even if the medicines become legal, she would continue to work underground because that's where the sacred container is. So you can see this is a different point of view from Mind Medicine Australia and the way the medical organizations are holding these medicines. And so part of the purpose of my book is to give these women a voice, but also to bring their wisdom and their lessons into the mainstream culture so it can be integrated into legal, legitimate use. Because what we're all faced with is, how do we train people? And these women trained by doing their own individual work, their own therapy work, really, with the medicines, and then they apprenticed. So that took many years. And at this point, with the mental health crisis that we're in, we don't have, therapists can't take many years to train. So we're not going to be able to repeat the process that these women went through of really working on themselves, of experiencing all the medicines at all dosages. And you know, I've asked the women about lighter dosages, higher dosages, and they really know the territory because they have done everything. And that's just not so easy to do in this time. And also it's illegal, so there's a problem with it. But I want to say they're not therapists and they're not shaman. They really are sacred priestesses. They sit with you. So they're closest to the priestesses from the ceremonies in Greece from thousands of years ago. And, you know, I was talking with, you know, I have, because the interviews were so in depth, I have now a whole new group of friends. And I was talking to one of these women elders the other day and saying how, you know, the problem with the integration and the research protocols is 3, 4, maybe at the most 5 sessions. And I've heard from many people who've gone through this that that's not enough. And I had recently met with someone who went through a Johns Hopkins. She'd participated in a Hopkins research study for long-term COVID. And she asked me the question of, what do I do with this experience? I can't get back to it. I can't recreate it. She's a long-term meditator, I meditate, but I can't get back to that experience that I had in the journey. And I asked her, did you feel like you had enough integration sessions? Because this is a really basic question. What do you do with that ineffable mystical experience? And she said, yeah, I thought I had enough integration sessions, but in fact, she didn't if she was asking that question. So this is the kind of thing that we have to learn. And so I presented this story to one of the elders. It was just the other day on the phone. And she said, well, what's missing is people need to be introduced to practices to continue their process of relating to nature and receiving messages from nature and being able to tune in the present moment to the experience of being in nature, and that this is a practice just like meditation is a practice. And you know, it opens the, now she was trained in her work, you know, the women were all trained differently, their apprentices were all different, and she apprenticed to a Native American who adopted her, so she called him grandfather. So you get the nature-based mysticism that came through Native Americans, but there needs to be some kind of, in the integration, there needs to be some kind of way for the person to understand they can continue to work with their numinous experience. It's not just about recreating it, but what do they learn from that experience? How does that change who they are? And this is a theme that will come up later on in my talk, because the underground women, the elders, have a different way of looking at progress than the mental health professionals do. But this is the key question. So when someone comes out of the Hopkins study and has this kind of a basic question, I'm concerned that the integration didn't open enough of a pathway for her in her life. And this is a very smart, highly educated woman. So something's missing. And the women elders have different ways of speaking to that issue. So next slide. So this was some of what I wondered about. What is it about these women that led them to recognize that this was a sacred experience, that opened them up to spiritual experiences when they were very young? And there's research that takes a look at, it's the best research I know that can measure someone who has a thin veil, who can fluidly enter into expanded states of consciousness. And it's a questionnaire that was developed to measure hypnotic susceptibility. How easily can you be hypnotized? Which is, by definition, a shift in the state of consciousness. And these women were very fluid in their capacity to shift states of consciousness. They could move easily. And this is a very interesting psychological trait that I think we, in terms of research in psychedelics, we need to take a bigger look at, because I think, now this is I'm speaking as a psychologist now, I'm not, they don't think like this. This is new information for the women elders. But as a psychologist, my hypothesis is that if you score high on absorption, on the variable of absorption, you are likely to not need as high a dose. So we are learning how to use different dosage levels. There's a paper that came out about the European use of dosage levels, how they're using it more integrated into the process of psychotherapy. And it's, I think, a neglected use. Neglected isn't the title of the paper. Scott, I can give you the reference later. But in Europe, there's the psycholytic approach to using these medicines, where they, and this is a very expensive treatment, but they might do a low dose journey, not a microdose, a real journey, but a low dose journey once a month within the context of ongoing at least weekly psychotherapy sessions. So this is expensive, and it can go on for a year or two. And this is one approach that's using a whole different dosage system. In the United States, we're still sort of like cowboys, and there's still an implicit value that more is better. And the Europeans are really saying maybe less is more, and working very differently within the context of psychotherapy. So I think beginning to collect data, measuring absorption might be helpful for us to know how to better titrate the dosage. I'm too old to do that research, but it's a great research study. It'll lead to a number of them. I still have research ideas, even though I'm retired in that sense, and I'm just writing. Okay, so the next slide. So I'm trying to sell this questionnaire. And the thing with these women having thin veils, this openness, is it enables them to have a relationship with the medicines, especially the plant medicines. And one of the women feels that she has a relationship with MDMA, which is we usually think of as a chemical, but it does come from, I think, a sassafras tree. I could be wrong, but I think that's it. But one thing that was unusual about the women, because I had spent long periods of time, I mean 5-6 hours with a few of the underground male elders, and I felt that they didn't exactly have the kind of personal, intimate relationship with the plants that the women did. And this is part of why I limited my interviews to the women, that it was part of what they did, part of what their integration and ongoing work with their medicines had to do with their personal relationship with the medicine as a plant teacher, the spirit of the plant. And this is outside the realm of academic research studies at this point. I mean, we're now in a different world where we're talking about plant spirits. The best book that talks about them is Jeremy Narby's book on, I think the accurate title is Plant Teachers. So it puts the person working with the medicine in a student position, learning from the plant. So this is a whole different way of holding the medicines and the journeys in a cultural cosmology, that we can be students who learn from the plants. And I mean, certainly this was present in my previous book, Listening to Ayahuasca, where I felt clearly that I was listening to ayahuasca. I was getting messages, and that was part of a personal relationship. And I have to confess, I score high on the absorption variable. So, I shift states of consciousness easily. So of course I could hear from ayahuasca as a plant teacher. But this is a whole other realm that kind of is around the medical studies and use of these medicines, but it's not directly part of it. But I did a research study of ayahuasca use in North America, and because I knew some of these women elders even back then, that study was published in 2012. One of the women told me to ask the question, do you have an ongoing relationship with the spirit of ayahuasca? Now, the academic research teams can't ask this question exactly, or they haven't worked up to asking this question in a research study. But Hopkins did do an internet study of asking, I think they had a couple of thousand responses, asking, did you encounter an entity on a psychedelic journey? So they got thousands of answers. They could divide them into groups depending which medicine they used. But they only asked, did you have an encounter? One encounter could be a yes answer to that research question. Because they did not ask the elders, the women elders, they didn't know to ask, do you have an ongoing relationship with a plant spirit? And so they missed an opportunity, because an ongoing relationship with one of these medicines is present whether the medicine is present in your system or not. In other words, that relationship is there outside of the journey, outside of ceremony. And that's a whole different cosmology. And Hopkins is asking about entities. It's a short leap to ask about an ongoing relationship, but they didn't know to ask. So this is one way that I would like, the researchers and the medical way of holding these medicines to learn from the elders. So the next slide. And this is, Laura Huxley gave her husband Aldous a shot of LSD as he was dying. And so she knew a lot about being a guide. And this is her statement, that the most difficult thing about being present, being a guide, is keeping your own psyche out of the client's journey. And the way this is talked about in the underground is, don't get between the person and the medicine. Don't interfere. And sort of the more, and this is in the Leo Zeff book, the Secret Chief. He talks about the more comfortable you are with your own psyche and your own work with these medicines, the more you can be a quiet presence. And I want to clarify, I am not a guide. And one of the reasons I'm not a guide is I think I would be asking, are you okay? What's happening? It's like, that's not necessary. The more, that would be out of my own anxiety. So it's a quiet presence. And I talk about that quality of presence and how the women developed it and what that means. And that comes from one's own work. And that's the only way to keep yourself out of the client's journey, is to do your own work. Stan Groff writes about this in about a dozen pages in his LSD psychotherapy book. And he writes about it in an analytical context, because that was his training as an analyst. And so he talks about countertransference, but it is essentially the same thing that Laura Huxley is saying. And he goes even farther, and he says that someone under the influence of one of these psychedelics has almost a psychic or a paranormal ability to pick up what the guide has going on inside of them, what they're thinking, what they're feeling. And so even if you're sitting there quietly and you've got a lot of your own stuff going on that you haven't worked out, your client can pick that up. So the more work you can do on yourself, the more clean you can be as you sit there with them. And this is the message that I hear consistently from the elders, Laura Huxley, from this book, The Secret Chief, and from the women I interviewed. Okay, next slide. And so, I think you gave me the wrong PowerPoint. It's okay. It's the same slides, but my graphic designer made them actually better. But this was my original slide for this. No, it's okay.
I apologize.
I know, no, it's no problem. It's really the same thing. But she improved on the slide because she didn't like, this was too big a leap for her. This is a book about Turkish rugs. So I could understand why that's sort of a leap, because how does that relate? But this was Christopher Alexander's the author of this book on 12th century Turkish rugs. He specialized because he was looking at the apprenticeship it took in the 12th century to weave these rugs. And the apprentice would spend 15 years learning how to do the dyes and had to invent a color that nobody had seen before in order to graduate out of the apprenticeship. And so I talk about the woman who trained with a Shipipo shaman after, oh no, don't change the slides. It'll be too confusing. she was training with a very powerful Shipipo shaman. And after 6 years or so, he said, "You're ready to sing the Icaros in ceremony. Oh, you're going to change them." I'll keep talking. It doesn't matter, Scott. It's okay. And she said, after 6 years of studying with this really powerful shaman, she said, "No, I'm not ready to sing the Icaros." But she sat right at his elbow. That's the definition of an apprenticeship. In ceremony, she sat, there you go. Good for you. Well done. This was her improved version of a Turkish rug. She sat at his elbow and he would sing and she would sing a nanosecond after him. And she did that for a whole year. So her apprenticeship with this shaman went on for 7 years. And now she's been working on her own as an independent shaman, really, for 25 years. So you can get a sense of what the women elders did is not something we can do now, but we can learn from them. Okay, next slide. We'll see. And so here's one of, now she died about 1.5 years ago. This is Anne Shulgin. She was married to Sasha Shulgin. And she's saying the same thing that was in that other slide that Laura Huxley said, and that you have to work on your own shadow. You must know your own territory to be able to be present for your client so that they can trust you. And she talked about, you have their psyche in your hands, and for them to trust you, they have to know that you know the territory. So this message comes through again and again. And it's, I said to one of the women elders, I said, not all therapists have done their own therapy. So you can look around you and ask each other, have you ever had therapy? And she could not believe that you could be a licensed or registered therapist and not have done your own therapy. She didn't know that was possible. So, and I tell people, if you're looking for a therapist, don't ask them what approach they use. Ask them if they've had their own therapy. It's a much more relevant question. And so here again, we have the same message. Anne was famous for working with the shadow, and she's really saying the same message. You have to know your own territory. That's the best training to be a therapist. And then here's the book I keep referencing and suggesting you look up on the internet. And it's this quality of an abundance of heart. That's the essential quality. And, I had a terrible time. I was in a research office for a decade. And as part of that research, I was at a medical school. And I had an opportunity to train with the psychiatric residents in family therapy. And so it was it was like a 6-month training in family therapy. I was never any good at family therapy, so I never really practiced it. But I can tell you, this group of psychiatric residents were dangerous. And what they were missing was an abundance of heart. And this is the essential quality that's needed. And it comes from your own inner psycho-spiritual work. And so what I mean by that is the kind of cleaning out of childhood trauma, your own childhood history, and in a way that allows compassion to grow in your heart. So yes, I think I'm participating in this training program. I think they're important. And there are other processes that are as important. And this is how to expand an abundance of heart. This is really, I did hear this in graduate school. There was one old professor who said, and he was referring to, if you're going to go into private practice, he said, if you have a client and you find that you cannot love them, refer them out. And, I did that 35, 40 years, I had a few clients I just referred out. If somebody else would be better for them, is what I said. So this is, and you can sort of see it in his face. I mean, there's just, this grows out of your own work on yourself. Okay, next slide. So this is really my position on integration. The elders do a sort of debriefing, but they don't do, because they're not therapists, they don't do a psychological integration. And I want us to admit that we don't really know what this is. It's going to be so different for so many different people. And we also have to admit, as therapists, I mean, if you talk about evidence-based psychotherapy, there's a lot of controversy about how does psychotherapy work, what's the most effective for what diagnoses. There's a lot of unknowns here, and an integration after a mystical experience. You know, there are in the chaplaincy program at Naropa University, which is in Denver. So this is how people become chaplains, and they're beginning to work as guides. And there's the psychedelic training program for chaplains, and they're really sort of saying, we're better at this integration than the therapist, because we're used to talking about spiritual experience and spiritual ways of being in the world and cosmologies. And we're also trained to be more eclectic, not just not to have a broader view of religion and not just one way, certainly from Naropa. And for instance, there have been criticisms of the John Hopkins playlist for being too European, too Christian, and too locked into one particular spiritual viewpoint. So I think we have to be really open about what integration means, and what's really needed to help someone use their experience in their daily life. And what we're up against here is a cost-effective treatment. And the fewer integration sessions, the more cost-effective, the less expensive the treatment. And I think we're going to go in that direction. People are talking about using artificial intelligence instead of live therapists, which drives some therapists crazy. But this is how to cut expenses. But I think I want us to sit with this question a little bit longer before we give up on it. And my hope is, as these medicines become more established as an acceptable treatment, that there are lots of options for people. So one option might be, yes, a research protocol where you get 3 to 5 integration sessions. But some people might say, no, I want to work longer in therapy with someone. And I can tell you, I work regularly with a Jungian analyst now. And God knows I've had a lot of therapy. And here I am back with a therapist. And she's very helpful. She's the most helpful therapist I've ever had with working with numinous experience. Little advertisement for Jungian analysts. Okay, next slide. And so integration in the broadest sense is these medicines are used in vivo, not just in research protocols, throughout life. This is how they're certainly used in the indigenous cultures. And Albert Hofmann is, of course, the chemist who developed LSD. And here we have, he died at the age of 102, and his last acid trip was at 97. And I've since been told that he did an acid trip once a year. So you get this sense of there's an unfolding relationship with the medicine that's ongoing, that changes as you move into different life stages. And I can tell you, I did illegally, of course, when I was in the late 60s, I experienced psychedelics. I was in my early 20s, and those experiences were nature-based. I was always very serious about it, but they were very different from working with the research protocol where you're turned inward with eye shades, and also at this stage of life, where many of my journeys are about my own mortality. And I imagine his was at age 97, he was working on it. Next slide. And along the process of life, and also with many journey experiences, this is a quote from one of the elders, and it's about life and it's about journeys, is that no one skips. I think it could have been, the quote was, no one escapes dismemberment. No one skips dismemberment. If you think about your lives, everyone has some devastating experience where they feel like they're falling apart. And so the question about these medicines is, how do they help us live our lives? I mean, I think it's the Buddhists who talk about suffering is part of life. And so this is a question for integration. How does this mystical experience help us deal with these very hard times? And these are quotes from the women elders. The next quote, I think, is coming up. The next slide. And this is another quote. How do we work with things that are difficult? And these are integration questions. How do you use this experience to face the challenges in your life? And if someone is working with these medicines at different stages of life, these questions have different meanings. I mean, I think of things now that are difficult that I would never have thought of in my 20s. I was sort of la-di-da in my early 20s. But now, I know a little bit more about suffering. The next quote, these are quotes from the women from the interviews. Suffering, learning how to be here in a physical body in this world, is the biggest teacher. I think this is the woman who's 90 now. So this was from an interview I did when she was only 86. This is part of the wisdom that comes from aging, and not aging alone, but a lifetime of psycho-spiritual work, and then the aging process. And if you're not up to this yet, if you haven't suffered enough in your body, you will. We all do eventually. And this is part of the NYU study that's looking at psilocybin use for what they call demoralization for terminal cancer patients. This is big suffering. This is facing our own mortality, and this is, a friend of mine calls this the final exam. How do we move through our own dying process? This is the biggest teacher. The next slide. And what the women elders look for, in contrast to the medical approach, is they're looking for an existential shift in a way of being, in a way of relating to life and their own life in general and their own life in particular. And of course, the medical studies are looking for reduced symptomatology, so that the person no longer qualifies for their previous psychiatric diagnosis. This is really a huge difference. The next slide. So they're looking for this kind of shift in the inner spirit of the person, and how to say thank you for everything that is. I mean, this level of acceptance with whatever life brings. There's a whole different way of relating to the world and relating to yourself in the world. Next slide. and to be joyful. So you get a sense this is really an existential shift the women are looking for. And if someone's coming in for journeys and they don't begin to see this kind of shift, this sort of transformation of a way of being, and they feel that someone is just coming in for the experience, like now the women complain that people call them and they say, I'd like to do a journey because I would like a mystical experience, as if they're ordering a pizza. That's not the way these women work. They're looking for an existential shift in the way of being. And next slide. And this is what the eldest of the elders said, and this is the level of what they're looking for, that we're responsible for our intentions, responsible to ourselves and to humanity. I mean, you get a sense of how broad, how big their vision is for what these entheogens can bring to the individual and to the world. And the next slide. And I think this is my quote. I say this every presentation, is, there's always a question of discernment. Do I take as gospel any message I receive during a journey? And here's the best advice I have, is to listen to the message that leads to the love that permeates the universe. And it again reflects a bigger view. And next slide, I think we're done. I want to say, I really neglected to say this at the very beginning, is this background is from a painting I bought at an art gallery that had a relationship with the Australian government so they could sell paintings by Australian Aboriginal painters. And the artist is Alma Nungaraya Grenadi. I know I mangled her name and I apologize for that. But this is the cosmic vision of the Pleiades, the seven sisters. And I bought it when I was writing the ayahuasca book, listening to ayahuasca, because I felt it was a vision of this ayahuasca space from a whole different culture. And I bought it for inspiration. And I live with this painting. It's wonderful.
Amazing. Thank you so much, Rachel. That was fantastic.